So I have a challenge, and that is my voice, which is getting deeper by the moment, but at least is hopefully audible. I just want to reiterate that the Sinai the Health Hackathon website is really a very good resource. There are a number of videos that were made about challenges that a variety of stakeholders, basic scientists, clinical scientists, patients, other healthcare professionals commented upon that may be very instructive for you to discern a particular problem or challenge that you think you might want to address. So I'd encourage you to look at those if you haven't already. At the bottom of that page, you will also see all the pitches from last year's event. And that also may be very helpful as you model your own pitch going forward once you have coalesced your idea and pursued a prototype. So I'm going to try to provide an almost impossible overview of novel technology solutions to address unmet needs in cancer from bench to bedside. And what I'm going to try to do is just inspire you to think outside the box of many situations and scenarios that we take for granted that technology might be useful in solving. So, of course, we know that cancer is a big health issue worldwide. It's rising incidence globally. There are more than 1 million, close to 2 million new cases and 600,000 deaths annually in the U.S. At the same time, there are limitless possibilities that are apparent. We have more data to analyze than ever and problems related to that, biological insights, therapeutic possibilities, and resources available more than ever. How do we harness those? How do we analyze that information to come up with solutions? And how can technology and device development approach that? There are numerous stakeholders involved. How do we appeal to them? How do we get them involved? Again, a possible thought for technology. And meaningful problems in cancer are both big and small, affecting populations, but also individuals. And no problem is too small or inconsequential to solve. So as you think about challenges that you want to undertake, don't be too focused on how big is this problem, but how feasible and how realistic and how consequential can it be? It could just be something simple that affects the well-being or emotional well-being of someone who's suffering from cancer or their care provider, and a tool that you might be able to develop, a device, an app, a technology solution that will address that. Impactful solutions to problems can be significant irrespective of the size. So what's essential for this event is to follow your curiosity and think about the obvious that one often takes for granted. I always wish that I had invented the Post-it. Now, just in terms of trying to bring a range of disciplines together, this gathering tonight and for this weekend is not far. This is part of a whole movement, and this is just taken from a recent event in June sponsored by the Koch Institute of the converging of science and engineering to solve problems in cancer, both from a organ-specific approach and a technology-driven approach. So when we think about cancer medicine or cancer biology, we break it into domains that are really a spectrum, from basic research that seeks to understand fundamental aspects of nature that provide a foundation for advances in ultimately diagnosing, managing, treating, and caring for patients with cancer. Clinical research that tries to harness the discovery science and solve problems of disease in the clinical arena, population-based research, and then translational science that moves this process from bench to bedside. In all these instances, there are people and processes involved. People who are working hard and could benefit from a variety of solutions that could help their job be performed more comfortably, better, someone who's working in the lab, maybe pipetting, and maybe they're developing a problem with their elbow because they're constantly pipetting, and maybe you can come up with an appropriate device to rest their elbow on and solve a critical problem that's meaningful for the researcher, but may not be the biggest issue in cancer, but still very important nonetheless. So one way to think about this spectrum of research and the spectrum of cancer discovery and clinical application is to think about the processes involved and the people involved in doing that, and how could you bring technology or novel device development to solve issues for those individuals or the processes that they're trying to uncover. And this just is another example. Here on the left-hand side, we're looking at a laboratory investigator carrying a bunch of trays. He's got to learn how to balance that, and maybe he has to go several floors above where he's currently working. Developing some type of device to help with the carrying of that might address that need rather than spilling this on the floor. Likewise, on the right-hand side, we see a variety of cells that have a particular morphology and growth characteristics. Maybe we can learn from that morphology through machine learning approaches to understand how to predict whether cells grow correctly or don't grow correctly. What would that project? What decision tool could we develop to anticipate the consequences of that without having to spend the time further interrogating it? We could just automatically skip some steps. So technology solutions will help investigators in the clinical arena and the laboratory arena really discover in a more user-friendly environment and with more sophisticated tools. And so one way to think about technology and novel devices in cancer is to really look at the goals of those solutions. Ones that these really lend themselves to challenges and problems in the spectrum of cancer, from biology all the way to clinical application, is to reduce inefficiencies and streamline operations, promote connectivity, improve access to information and care, promote prevention, facilitate management of patients in the clinical arena, but also management of laboratory experiments in the laboratory. So management and coordination of work or care to be performed, and the relief of symptoms. Foster communication, a pressing need, and in fact among our own community, when we put out a question of unmet needs and asked people to respond both outside of our cafeteria and our library here, the overwhelming statement that people wrote was better communication, faster communication, real-time access to real-time information. So fostering communication is a great enterprise and something that technology specifically lends itself to. Reducing costs, accelerating discovery, and making medicine and the delivery of care more personalized. So by doing that, one can allow individuals to be connected as they explore clinical care and basic discovery, make those pathways interconnected, and allow people to talk to one another in a fluent manner. That's the promise of technology and novel device development that you'll be working on. So I want to give you a little bit of a perspective, and these are broad strokes, of some of the cancer care challenges that you might think about addressing. Physical symptoms, symptom relief, real-time realization and characterization of those symptoms. There was a recent paper presented at the 2017 American Society of Clinical Oncology where they utilized a tool to really have real-time reporting of symptoms in a particular area of cancer and showed that this translated into improvement in survival because these were actionable at an earlier point in time. Emotional and psychological needs, spiritual and existential distress, and tools that might help to address that. Use of virtual reality tools, apps for a variety of purposes, devices that take people outside of their suffering. Financial distress, the administrative burden of care, which lends itself to lots of technology solutions. fostering this ever important concept of communication, and by offloading administrative burden, actually enabling adequate time for care provider and patient relationships to flourish. And we're going to be hearing from Cardinale Smith about disparities in access to care as one domain in cancer, in the clinical sphere of cancer, that lends itself to technology and device development. Another way to think about applying technology or new devices is to think about how cancer patients who suffer from this disease actually spend their time and how they would like to be spending their time. So someone with cancer might have to spend their time in bed, in the hospital, in unfamiliar environments, in isolation, in a doctor's office, inside, indoors, and alone. So tools, virtual reality, apps, devices that would take one outside of this experience and put them in a situation that might be closer to what they'd really like to be doing, might be something to think about. They also have time spent that's lost from work, away from school, away from friends, without official relaxation periods or vacations, and often without intimacy. So again, we have a lot of novel technology tools in our toolkit to think about how to address some of these critical dilemmas and problems that patients with cancer experience every day as individuals. So we think of the pillars of cancer care as being surgery, radiation therapy, chemotherapy, which just means chemical therapy and started as antibiotics, precision therapy, and now the raging field of immunobiology and immunotherapy. But it's important to think that along the way, especially in surgery, that surgery has evolved over time to much more sophisticated tools and the use of robotics to reduce the burden of symptoms from surgery and improve outcomes. So devices in this arena and other tools, machine learning algorithms that will help really promote better types of surgery, more accurate surgery, are things to think about. And this is analogous for radiation therapy, how drugs are delivered, devices that will enable better delivery, faster delivery, shorter times, a variety of pumps. There are pumps out there, but there may be other pumps that would be more user-friendly, wearable, enable people to be outside instead of indoors receiving a treatment, etc. All food for thought. I'm going to skip over this because Dr. Smith is going to be spending some time, but suffice it to say that health disparities exist, and there are a variety of aspects to disparities in health that lend themselves to technology solutions, such as access to care, social and economic status, clinical trial participation. How can we reach patients with a variety of backgrounds, not just one type of background, to really participate fully in all of the benefits of cancer care? On the other side of the spectrum are those who care for cancer patients, loved ones, as well as the allied healthcare professionals. And they have needs as well that can be addressed through novel technology solutions and devices. The need for team working, diagnosing, managing, communicating, documenting, listening, observing, evaluating, coordinating, supporting, and caring are all lend themselves to a variety of solutions that would help efficiencies and processes in making these more user-friendly, more expedient, and more integrated. There are adverse consequences of caring for cancer patients, both on loved ones as well as the healthcare providers, the team of allied healthcare professionals who are involved in that process. The sheer burden of care, emotional stress, fatigue and burnout, reduced personal time for enjoyment and relaxation, and altered sleep. All of these lend themselves to a variety of tools in the virtual reality domain, through wearable apps, a variety of other tools that in digital health that might lend themselves to counteracting these adverse consequences. And finally, the last area of food for thought is in the arena of survivorship and technology and device solutions. This is taken from a recent report of 3,000 cancer survivors, of the amounts of unmet need, practical, the financial burden and insurance, physical, infertility, pain and energy or fatigue, emotional consequences with regards to family, grief, fear. Again, these are problems that patients with cancer in the survivorship who are now well experience and that might be addressed through a variety of solutions. Survivorship issues are divided into these domains: physical problems, psychological problems, social problems, and practical and financial issues, all of which lend themselves to the kinds of solutions that you're going to think about and work on this weekend. This is from, again, a recent ASCO from that same presentation, ASCO of 2017. These are some unmet needs that were noted by survivors. I need to help manage my concerns about my or my partner's cancer coming back. I need to know that my or my partner's doctors all talk to each other to coordinate their care. I need to feel like I'm managing my partner's health together with the medical team. I need to be provided with information in a way that I can understand. And it's all the little things that make people feel better or worn down. So these are all issues that are potentially addressable by the solutions you're going to approach. So the purpose of this hackathon, Health Hackathon, focused on cancer, is to foster team science, technology innovation, and entrepreneurship. And just as the picture depicts, an umbrella is not just an umbrella, and that innovation is a state of mind, and collaboration is everything.